neutralize the pelvis. So you have to bend the knees and bring your hips up.
How many
Three
times?
times. 3 times. Okay, held 3 times. And then you basically are having them do a chin tuck. So that cervical retraction exercise that we talked about. So you have the patient continue to keep their knees down. Okay. And then you're going to have them do a retraction, which is just like coming back. Remember a chin tuck. But the difference is that you have them tuck their chin, and then they engage the flexors by taking chin to chest. So it's basically like a retraction with the chin to chest. So everybody try that just to feel what that feels like. Retract, and then tuck. So that's helping to engage those deep what? Flexors, deep cervical flexors. So you have them practice that. So just retract and tuck. So it's more than just the retraction part. So she's retracting, then taking her chin, but not real far. Not they don't want them to go too far. It's a very minimal, very short movement. So retraction and down.
So like this.
But don't lift your head up.
Oh, okay.
Don't lift your head up. And then relax. And now relax. And then tuck, retract, and tuck, and hold. And relax, and retract, and tuck, and hold. So once how do we know if they're doing this correctly? The video told you could use like a blood pressure cuff underneath her neck right here. You would just slide it underneath, like right below the mastoid process, and then you would have them do that. And when they retract, so do it again, retract and tuck. You'll watch to see if that pressure gauge in the sphygmomanometer is going up, so that you know they're actually doing the exercise correctly and engaging the flexors the way you want them to do so. Okay, so then after you, they have that, so they have to get that correct first, then you have them move into distal movement. So after they have that, then you're going to have them to tuck their chin, holding that position. So retract and tuck, and then you have the patients move like the one arm into flexion all the way up and back down, and then the other arm up and back down. And then once they get good at doing one at a time, then you can have them bring both up while holding, and then back down, and then relax. And the key to this is that each time, just like we talked about with some of the other exercises, you want them to release so that the muscles have to engage each time. So Carly, retract and tuck, hold, now lift your arms up, bring it back down, and then relax. Good, tuck again, tuck, and then up, and then relax after each time. So, and you can add different, and then the video you'll see, and today, I know we're not learning this yet, but I wanted to just show you this. Then you add different movements of the arms. So you can have her externally and internally rotate while holding, and she would do the same thing after each one of those. She would relax. And once she gets the individual distal movement good, then you have her do combined movements. Like I'll have Carly do hold, and then what I'm gonna have her do is come up, out, and then here and down. So you can do whatever combination that you want. So sometimes they'll say, up, out, then back down, and then rotate. So they're doing all of those movements while still holding that stabilization position. So that's really challenging those deep flexors.
I feel it.
Right, you're down. You probably do more so in the neck, but you can feel that. Okay, so that's the deep cervical flexors. And then when you moved over, the next page, when it was in the minimum protective phase, it was the scapular cervical stabilization exercise emphasizing the extensors. How was that different? The patient was then on their stomach. So, and then for this one, it becomes harder because you have them with their head off the mat. So you have their heads off the mat. And then she's still doing the same thing, except she's just coming up into that retracted position. So she's just retracting up and then back down. So you're just having her to engage the extensors more. So here you're not as worried about the chin tuck. as you are just that retraction and hold. So she's just retracting and holding there. And then once they become, again, good at this, then you add the distal movement. And Carly will say you can relax and can come back onto the mat. This one's much harder than doing the flexor. So that's why we move from flexion, stabilization exercises to the extensor in the minimum. So the moderate protective phase, you could add in these recruitment of the cervical flexors after, and then we'd move into recruiting the emphasizing the extensors. And what was this? We were treating what here? This was exercises for that patient that had the herniation in the cervical spine. So these would be added in the late, moderate, and then the minimum protective phase after a herniated disc. Okay. All right, thanks, Carly. One more person, and then we'll just do a few more things. So who else? So did you, Jenna, volunteer? Somebody volunteered a minute ago for that. Being wings for 3 times. And I just wanted to show you all just a few of those that we talked about. For suboccipital release. So just so you can see what it looks like. I'm going to have my hands right over that suboccipital region. So that's right at the base of the skull is where the SOR is, the suboccipital region is. And when you're doing suboccipital release, you want to get right on that suboccipital area and just do some of that gentle kneading. It's kind of like we did with the thumb knead. You're just doing that kind of modified with your fingers. So you're just kind of getting them relaxed before you actually do the pressure, because suboccipital release is that deep pressure that you're going to put, and you're going to go, it's more of like in an anterior superior direction. So I'm going to push up forward and then pull superior and then hold. So that's very key to go here, here, and let the head just be kind of on your fingers with all that pressure. And you're applying a pretty good amount of pressure. It's a very firm pressure once you get there. So I'm just going to kind of do circles, and when you feel like they're relaxed, then you're going to kind of apply that anterior and superior force. And so then I'm just holding that, and then you want to hold that with pressure that is like a almost maximal pressure. And then you're going to hold that, if you can, for a minute, and then you want to let off a little bit, and then do those kneading strokes again, and then go back to that full pressure and hold again for a minute. And while you're holding, then they should say, you know, if it begins to release, what are they going to tell you? They're going to say, oh, it was quite a bit of pressure, but now it feels like it's easing up. And that means that it's beginning to release, because what's happening is you still have the same amount of pressure applied, but they're sensing less pressure. So then you know that suboccipital release technique is working. And the ischemic release was, again, this is a form of ischemic release, but when you see the word ischemic release, a lot of times it's talking about here at the upper trap muscles, where they're doing that, finding where the muscle's restricted, and once you find that kind of area of tightness, you kind of go back and forth there with that massage, that kneading. Remember, we even did this digital squeeze, remember that, from modalities. You want to get them as relaxed as you can before then you apply that pressure that's going to be uncomfortable to them, you know, getting upwards toward that deep max pressure, and they're going to feel uncomfortable. But as you hold that again for 60 seconds, hopefully they're not feeling it as much, and then you relax and go back to the kneading for those 5 to 6 reps of 60 seconds. Hopefully they'll feel some relief. Okay, and the last one, and then I'll let you get to practicing, is the side glide. And when you are doing the side glide, you're using your, what's this joint here? The
MCP.
MCP joint here. And that's where your pressure is going to be. So you have to palpate the spinous process that you're looking for. And it's hard to tell, you know, when you're palpating, but you're gonna be palpating these spinous processes. And where you want to be is on the facet joint. That is where the disc is. So where the disc is bulging. So if it's a C5, C6 bulging disc, then you're going to palpate down, you know, 2, 3, 4, 5, 6. And you want to palpate below, be on the spinous process that is below the herniation. And once you're on that spinous process, then you're going to swoop around so that your MCP joint is in the disc space. Because you palpate down to the below vertebrae, spinous process, then you come around, and then your MCP is going to be in that disc space, which is going to allow for the appropriate glide to occur. And this will take practice. This is what we're going to be doing next week after all of you've got an A on this practical with the information. We're going to move to the spine. So what we're doing here is we're coming off of the plinth. So their head is in my hand, and you're cupping with one hand, and the other hands will be doing the gliding. So how do you find the spinous processes? You either palpate down to C7 and count up, or you palpate the first process up here and know that's C2. So all of you should be pretty good at that by now, but you'll start re-practicing that, and then I'll count up to 6, and then come here where I want to be, and then I'm going to provide a little bit of distraction with this hand, and then the glide with the other. And your elbows should be more at making a 90-degree angle and be parallel again with the treatment plane. And then I'm gliding this way. And that glide, again, you're not going to be doing the grades. You're just going to be doing a gentle, you know, really 1 or 2, just to show me you know the direction of the glide and your hand placement. So I'm distracting and then gliding. And how did we name the glide? This is going to be a left or a right side glide.
Pushing from our right side.
But I'm gliding, it's opposite. I'm going here, I'm doing a left side glide, correct? Yes. Left side glide that's going to improve what range of motion?
Right sideline, or right
Lateral bending.
lateral flexion.
Yes, right side bending or lateral flexion. So a left side glide improving right side bending. So this would be indicated for what type of disc herniation? A right. Good. So if they have a right disc herniation, I'm going to do a left side glide to, you know, gain range of motion this way to squeeze the disc back in. So left side glide, improving right side bending to reduce a right posterior lateral disc herniation. And then from here too, I could do those retractions as well. And you always, when you're doing cervical retractions, you're doing distraction, retraction. Distract and retract.
So you're doing passively for her?
Mm-hmm. Yeah. And this is a good exercise too if they have a disc herniation, or even if they have whiplash. The muscle, it elongates those muscles along with gapping open for a disc herniation. So it's a kind of a twofold effect there. And you'll see on the exercises that I listed for the cervical disc herniation, these can all be done in that maximum protective phase, as long as there's not a lot of swelling that we're dealing with. if there was a lot of swelling, then we'd count on more modalities to handle that before we would move into this, but a lot of times they're not gonna have a lot of swelling, and you could go ahead and move into these manual techniques alongside your modalities.